Chancellor of the University of Nottingham. Let's speak to Gavin BBC now, Professor of Global Health and Public Policy at the Duke Global Health Institute. That's at Duke University in the USA. His piece in the British Medical Journal this week looks at the lessons to be learned from American colleges opening last month. Welcome to the programme.
Good evening, Claire. Nice to be with you.
It's great to have you. We're also going to be hearing from Sedi, who's going into his third year studying maths at the University of York, and Laura as well, who's going to York to start her first year of her degree in sociology and education. Welcome, you two.
Good evening. I hope you're well.
Yeah, it's good to have you here. Hi, Laura. Hi, Laura. Listen, we're probably going to keep you with us till after the news as well, so we've got a bit more time with Gavin BBC, so bear with us. But Professor, you've been looking at colleges in the USA that opened in August, because obviously that's where the autumn term starts in America. Tell us what happened.
Yes, so we reopened much sooner than the UK, beginning of August, and the national reopening experiment here has been pretty much a disaster. I mean, there are a few colleges and universities that have managed to avoid large outbreaks, but we've had 51,000 cases at least that we know of across university campuses. We've had 5 universities now that have joined the so-called 1,000 club. They've had 1,000 infections or more, plenty other universities knocking at that door. This was entirely predictable. We do have a different epidemic here than in the UK. I mean, just yesterday, we had over 50,000 new cases. So our epidemic is worse for sure. And it was predictable not just because transmission rates are so high, but many universities didn't take the kinds of precautions that you need to take to avert clusters and outbreaks. I mean, you know, many of us working in academia, in higher education, months ago were writing pieces saying there is going to be this kind of catastrophe. You know, you could predict, just as nursing homes or cruise ships were tinderboxes, universities were going to be the next tinderboxes. And I'm very, very deeply depressed to say we were right. And what the reason that I wrote this piece in the British Medical Journal with Dr. Rochelle Walensky from Harvard was that what we wanted to do was to lay out some of the lessons from the US that UK universities could adopt. And there are
what did they get so wrong then? Was there no plan then? Was it up to individual institutions? Was there no kind of governmental advice or guidance?
Well, don't forget, Claire, we've got no functioning government when it comes to COVID-19 control in the USA. There is no federal COVID-19 control plan. The Trump administration has remained asleep at the wheel. There was no coordinated vision for safely reopening universities nationwide. Every university had to go it alone. And what we have found is that essentially there's 5 big lessons. One is, if you've got lots of COVID-19 in your community, it's really hard to reopen with high rates of transmission around you. You cannot hermetically seal your campus off. And whilst it's still early days, it does seem as if universities in places where there's not a lot of COVID-19 are doing better, in Massachusetts, for example. The second is that some universities didn't do quarantining. I think that is a lesson for the UK, right? You might be a university in a town with very little community transmission, but you're going to have students coming from high transmission areas or overseas. So a 14-day quarantine can be helpful. The third lesson is that, look, this virus can really transmit at lightning speed. It really can in students who don't have symptoms. And what we have seen in the US is that universities that have screened students, they've done testing on arrival, then they've done frequent testing after, have done better. In fact, the best studies suggest that you actually need to test everybody 2 to 3 times a week. The fourth lesson is that blaming students isn't going to work, right? There are some universities here where it was pretty clear that their strategy was based on so-called personal responsibility, right? An expectation that a student's never going to go to a party or never going to go to the pub. That is bound to fail. Shaming young people for risky behaviours is an ineffective public health strategy, and what you really need is something that we've used for promoting, safer sex or reduced alcohol use, which is harm reduction. Provide safer ways for students to socialise. And then the last lesson is we've got to be learning as we are reopening. What Dr. Walensky and I argued is that every single university that has reopened should publish what it's doing to keep people safe. And every single day, they need to be honest. They should publish a dashboard showing how many tests are you doing, how many infections are you seeing, how many hospitalizations, God forbid, how many deaths. And we really need to understand what protocols are working, and what aren't. If you're going to reopen a university in the middle of what is the deadliest pandemic in 100 years, a very high-risk endeavour here in the US, less risky in the UK for sure, but still has some risks, then the very least that people can expect from you, if you're a university leader putting lives on the line, is that kind of transparency and accountability.
Now, listen, we thank you for publishing this really important insight in the British Medical Journal because, as you know, university is about to open up here in the UK again. Is there any indication that everything that you've been saying is being listened to by anyone with any clout in America?
Well, it's really down to the local level, right? There are some universities that are putting these protocols in place. Again, early days. I do worry that some of the universities that did put all of these protocols in place, nevertheless, are still seeing, outbreaks and clusters. I think here in the US, you're going to need a lot of luck to avoid a cluster or avoid an outbreak. But there are universities that are working really hard. They are testing frequently. They are doing all the sort of what are called non-pharmaceutical measures, right? The mask, the social distancing. I would say one of the most important things that we now realize about coronavirus, the new one, that we didn't before, is that a large part of transmission is airborne through aerosols. So sitting inside a classroom that is poorly ventilated with a lot of people, that is high risk. So I think some of the best universities have been ventilating classrooms, making sure that their classrooms, if they are happening, are very, very small, putting in special filters, making sure there's universal masking. But really, it's making sure that the community transmission levels are low first before you reopen, quarantining before class starts, testing students on arrival, testing everyone very frequently, doing that to avoid disaster. And I want to just say one last thing, in case we run out of time, is it's true that young people who are infected, it is true that the death rates are low, but there's two really important things to remember. First, this is a new virus. We don't know a lot about it. And it looks like about 10% of people who get it go on to get long-term debilitating symptoms, as the GP
and the second
earlier talked about. The second one is that infected students can infect other people. Particularly, I am worried about the bus drivers, the cafeteria workers, the cleaners. In the US, at least 40% of people are colour, and when they get the coronavirus, they're much more likely to die.
And it's not good news. Gavin Yamey, you've started off a brilliant debate for us. Thanks for joining us. More coming up here on 5 Live.